Earlier today, I received a call from Minister Zweli informing me that they had been informed by the National Institute of Communicable Diseases that South Africa had now recorded its first coronavirus infected person who had been traveling from Italy and had gone to see a doctor, and the doctor immediately realized that we could be dealing with something serious and sent him in for the various tests and all that. So it's now been confirmed that we have a person within our country who has tested positive to coronavirus.
After weeks of misinformation and speculation, the first case of the novel coronavirus has been confirmed in South Africa.
South Africans should not panic. We should be alert so that if people either show signs of some of the symptoms, they should immediately be able to get medical assistance. And all our medical care people, whether in the private sector and in the public sector, being informed that their alertness in identifying this disease must be at a much higher level.
This update has stirred concern among South Africans who fear that they too may fall victim to the deadly virus.
So we should, as South Africans, be rest assured that government will demonstrate its seriousness in terms of dealing with this matter.
The first victim has been confirmed as a 38-year-old man. He, along with his wife, 2 children and his doctor, are under quarantine. They live in Hilton in the KwaZulu-Natal Midlands.
The feeling is pretty calm in the community. You know, we have a great history of community here in Hilton where we support and look after each other. As long as we share information with each other and everyone's informed, and we have really great communication structures set up here, then we can reduce the amount of panic, and we can increase the amount of proper information that flows to people. And I think it will be another instance of Hilton people sticking together and supporting each other, and it might be tough, but we'll get through it, and we'll get through it together.
So that's where we find ourselves this week on This Story, at the center of a possible outbreak. I'm Riaan Grobler, News 24 senior desk reporter, and I'll be anchoring this season of the show.
You're listening to The Story. It's a new podcast from News 24. We'll speak to journalists and experts about the week's biggest story. This is what we saw, heard, and uncovered this week.
We're crossing over to our Cape Town office where Bevan Lakay, who is Health 24's editor, is standing by to answer some questions. How's it, Bevan?
Hi, Riaan. Thanks for inviting me. It's much appreciated.
So, Bevan, South Africans are on tender hooks. Tell us what exactly is happening.
The Health Minister Zweli announced our first positive test case for coronavirus. And what we know about it is that it's a 38-year-old man. He is in KwaZulu-Natal. We've established also that it's in Hilton in KwaZulu-Natal. He arrived back on, I think we checked, and it was the 1st of March from Italy. And what we do know about Italy at this point is that there is a high prevalence of the spread of the virus in Italy. He was in a group of 10 people. He passed screening at the airport, which is obviously a very interesting point. He wasn't displaying any symptoms of the virus at that point. But 2 days later, on the 3rd, he did start displaying symptoms and went to see his private general practitioner. From that visit, the general practitioner was suspicious of what it could be, of course, considering that he'd just come back from Italy, did the tests, contacted the National Institute of Communicable Diseases and all the necessary authorities.
What other concerns have come up?
A question that will come up from what we heard on Thursday is because he passed the screening, he obviously wasn't showing any symptoms at the time, and therefore, there was no reason for him to be quarantined at that time or put into self-isolation. The big question is there are a lot of people coming from countries which could be considered high risk where the virus has spread quite rapidly. if you come back into South Africa and you pass quarantine, do you then just disappear? You know, what are the relevant health authorities do to potentially monitor these people, which is especially important because the virus can take up to 14 days for you to display symptoms. You know, the WHO says it's 1 to 14 days, and on average it takes about 5 days for you to show symptoms. But if you're not part of that average, you know, you can easily, in that sense, you know, not display those symptoms. You know, if you've caught the virus, pass the screening tests, and then what next? And the question then is were they monitoring this individual, this man who passed the screening test? We don't actually know. And we, as Health24, have actually put those questions to the NICD to find out further, because that is going to be quite important, we think, in terms of, you know, curtailing the spread of the virus. You know, are you monitoring people who pass the screening tests? You know, we understand that in terms of resources, that might be quite an extensive job. But, you know, if you are committing all these resources and trying to curtail the spread, you know, you obviously have to do as much as possible.
Let's quickly examine the term coronavirus, because that was the first term that was embedded in people's minds. But the current coronavirus, what they call the novel coronavirus, or COVID-19, is just one of many strains of coronaviruses. So what is the difference between COVID-19 and other coronaviruses?
I think the first thing you kind of need to do is establish what a coronavirus is. And the coronaviruses are part of a large family of viruses that cause illnesses ranging from, well, the common cold to much more severe diseases. I mean, corona, which I think a lot of familiar people with the beer, but corona itself is a Latin word which means crown or even halo, and it's in reference to the shape of the virus particle when you look at it under a microscope. But what's important to know about coronaviruses is that they're what are called zoonotic, and this means that they're transmitted between animals and people. And look, you know, common signs of infection are respiratory symptoms, fever, cough, shortness of breath, that sort of thing. But I mean, you've got this current, or the novel coronavirus, which I'll get to further in terms of its naming, and others like the SARS virus and the MERS virus, who are all coronaviruses. And as you've mentioned, there are actually plenty. I think if you look at this particular virus, it has been named. In sort of early to mid-February, it was named. It's called SARS-CoV-2, which is severe acute respiratory coronavirus 2. So actually it's named after SARS, which I think a lot of people don't know, but obviously because it was genetically quite similar to the SARS virus, although there are important differences. But at the same time, while it's named SARS-CoV-2, the WHO is trying to be very careful because of the sort of negativity and potential scare factor of calling something SARS. So in reference to it, they don't necessarily refer to it as the SARS virus, which can get a bit tricky. So they would call it something like the new coronavirus or the novel coronavirus, or what they would actually now also refer it to as the COVID-19 virus.
All right, so let's focus on the virus itself. SARS-CoV-2, it's called. So it's kind of like a SARS 2.0, if you will.
That's correct.
How does this virus spread among people?
Basically, it's people who are infected, who cough and who sneeze. And it's the liquid particles that are in the air. So if you are in proximity of someone who potentially sneezes or coughs, chances are that you are going to catch the virus. It is also spread from surfaces as well, but that is now obviously not the primary way it spreads. The primary way is indeed the in the air. But you know, if someone who potentially has the virus touches surfaces and you then further touch that particular surface or even an object, I mean, cell phones in particular could could be of concern, then you go and touch your own mouth, nose, or even your eyes, that's sort of the entry point for the virus.
So, Bevan, let's say you do get SARS, CoV, or CoV-2 or COVID-19. Is that necessarily a death sentence, and what should you do about it?
So it's not necessarily a death sentence. Most cases, about 80% in terms of some of the data we have so far, have been mild cases. It will just sort of, go through your body as a normal case of the cold or the flu. So, it's not a case of, you are, if you've got the virus, you're in for a tough time. Like I said, there are a lot of mild cases out there. However, it seems that the virus affects certain people very specifically, and it's much like other viruses. It attacks immune systems which are quite compromised. So from the data that we have so far, and especially what's coming out of China, the majority of people who have unfortunately died from it have been older people, number one. Number two, they've had chronic illnesses. So their immune systems are particularly compromised. And the other thing is also that you need to factor in, specifically from a China point of view, is that, data says that, about 50% of the male population smoke. So that certainly doesn't help in terms of your situation where respiratory illnesses are concerned. So if you're looking at let's say from the data I looked at today was somewhere from about the age of 30 onwards, but obviously more from, I would say, from what, 60 onwards. If you've got a compromised immune system, and if you potentially have an existing chronic condition, high blood pressure, any sort of heart condition, diabetes, you are on the side of being at a higher risk where the disease is concerned.
And that would include people with HIV or TB, for example.
So we don't obviously know enough yet in terms of how it's affecting people with HIV and tuberculosis, because if we're looking at the areas so far that have been affected, there isn't that high prevalence. So it's not like you can say, okay, we have case studies for 100 people and therefore we can have a look at that and take it into the South African context. That is a little bit difficult. But from the experts that Health 24 have spoken to, what they say is that it's a strong consideration is that we know that people with tuberculosis and HIV have compromised immune systems, and we do expect that they would be at risk.
One of the things that has been spreading much faster than SARS-CoV-2 has been the hoaxes and fake news. What are some of the biggest myths or misconceptions regarding the virus that you've come across?
The really big one that I think is sort of being spread, and this sort of came out in I think the date's 2003 when we had the SARS virus spreading, because at that time they thought, oh, cats are spreading the virus. But I think it's important for people to understand that while the virus is spread via an animal, it is not your domesticated animals that are going to spread the virus. So your cat and your dog is not going to give you coronavirus. I mean, there was a case now in Hong Kong, although I think which made a lot of people panic, where a dog tested positive for the virus, but it's what they call a weak positive. And the dog can't infect you with the virus. They can't pass it on to you. But I mean, obviously, you need to be cautious. I mean, you have to think about, like, you pet your dog. Your dog is a surface. You could potentially, the virus could potentially be on your dog's fur. In that sense. But so, as all times, if you pet animals, wash your hands. That's going to be an important thing. So for me, this myth, animals spread the virus, but it's not your domesticated animals. It's your sort of more exotic sort of animals. And to go back, they initially thought it was snakes, and they also thought it was potentially a pangolin. But, an interesting stat is that something like a bat actually carries around 100 coronaviruses. So animals certainly are in the mix in that sense, but your cat and your dog unlikely to be spreading the virus.
All right. And we've also had rumors that people can use Dettol or drink Jik to prevent getting the virus. We know this is not true, but what are some of the things that people can do that are reasonable to try to prevent getting this virus?
It goes back to basic hygiene, quite frankly. So, I mean, like I said, in terms of the virus being spread, most likely it's going to be from liquid particles in the air. So it's sort of basic things like, if you see someone coughing or sneezing, and I know you probably wouldn't always have the time to get out the way, but maintain distance, quite frankly. I mean, if you can keep yourself at least a meter away from someone you know who's been sneezing or coughing, that's important for you to do. The second thing is just, because you come into contact with so many different objects every day, hand washing is imperative. You've got to use soap and water. You've got to do it for significant amounts of time. In the absence of soap and water, you can use, one of these sanitizers, which include alcohol, and it's also got to be a reasonable alcohol content. I think it's around 70% alcohol content. But, it's going back to basics, quite frankly, which I think is so important, because you see people now vigorously washing hands and doing things that they should have been doing in the first place. So if there's any good in that sense to come out of it, is that people might go back to their basics and just sort of consider their basic hygiene. The other thing also is for when you cough yourself, cough into, or sneeze, cough into your bent elbow, don't cough into your hands, because your hands are most likely where it's going to, then spread from, because you're touching so many things. So yeah, just to wrap that up, it really is just about sort of what you personally can do every day. It's just going back to basics with hygiene.
So Bevan, as editor of Health 24, what are some of the most frequently asked questions from our readers that you've come across?
There's recent Google data which shows what South Africans have actually been searching for. What is coronavirus? What causes coronavirus? How did coronavirus start? How is coronavirus spread? How to prevent coronavirus? How many people have died from coronavirus? Is the virus in South Africa? What are the symptoms of the virus? Where is the coronavirus, and where does it come from? So these are the top 10 that South Africans are currently searching for related to coronavirus. And I think in many respects from the articles we've done, and I think a lot of what we've spoken about here today, we actually answer quite a few of these questions, which is great as well.
That was the voice of Bevan Lakay, Health 24's editor, speaking to us from our Cape Town office. Thanks so much, Bevan.
Thank you, Riaan. Really appreciate it. I hope this information is going to be a help to our listeners and readers.
We now have on the line Ilse Oelofse, a South African living in Beijing in China. She has been living in semi-quarantine following the outbreak. Hi, Ilse.
Hello, Riaan.
So you've been in Beijing since November last year. This was shortly before the outbreak. So tell us a little bit more about how you came to know about it and how you were informed about it.
My dad actually sent me a message and he's like, "Hi, are you wearing your masks?" I'm like, "Excuse me?" He's like, "Yeah, the virus. You must know about it." I'm like, No, I don't actually. Let me go read up on it. And then I went and read about it, and I initially was very scared. And I went and bought myself like 200 masks.
So in terms of news coverage in China, has it been huge or has it been sort of understated?
The news channels here is quite difficult to follow for someone who don't speak Chinese. My main source of information comes from either social media or just browsing the web for live streams of the World Health Organization.
Ilse, has there been no direct communication from health authorities in China?
Yes, actually there's this like a mini app, and then on that little app there's actually like news feeds coming through the whole time, so you can access everything on one app.
So Ilse, immediately following the outbreak of COVID-19, what was life like for you? Did you keep to your apartment, not go outside?
Immediately after I heard, and everyone was a bit frantic, it was quite panicked, and we went and bought like 200 masks and set up a little decontamination area in our flat. Just stayed in our flat as much as possible.
Were there times that you did leave your apartment, even if it was just for a little bit to escape being inside?
Yes, luckily we have little shops, like little grocery stores in our complex. So you leave the apartment and it's a 10-minute prep to do so, because you need to check that your masks are on correctly. And I say masks plural because I wear two because I'm paranoid. And I also have little gloves that I wear. And then just to walk outside, some people wear their masks incorrectly, where they don't cover their nose. And you kind of just walk to the other side of the street just to avoid them.
Now, earlier you spoke of your initial shock and being pretty scared. What is the atmosphere like in Beijing at the moment?
At the moment, it's actually quite relaxed. A lot of people have gone back to work. So like in malls and shops, and like the construction workers are back to work. I think it's mainly just schools and stores that have no like need to be open, that's still closed. But mostly people are walking around, taking their kids for a run around the park, but everyone is wearing masks at all times.
Ilse, if you could come back to South Africa right now, would you do it, or are you happy to stay there?
Absolutely not. I would stay here, mostly because I think this will get phased out, and I think with the summer months approaching, it wouldn't spread as fast. Hopefully, I can't say, but I think it's slowing down. And we invested so much money in getting here that it will be kind of stupid to waste all of that and just go back home. And also, I've got family that's immune compromised. I can't put them in that situation where I'm selfish and I want to come home and I'm just going to infect everyone in South Africa. They're not equipped to deal with it.
Right, that was Ilse Oelofse, a South African who's living in Beijing. Thank you so much for your time, Ilse.
You're very welcome, Riaan.
The Story is a weekly podcast by News 24. It is hosted by me, Riaan Grobler, and produced by Nokuthula Manyathi.